Hello friends. Welcome back to the Retina Imaging channel. We are back with a new video which is a two-part presentation dealing with newer terms used in dry age-related macular degeneration. So let us begin. New Lexicon, Dry AMD, Part 1, which explains the concept behind cRORA. The conventional term, geographic atrophy, is used for atrophy of macula in dry AMD. Geographic atrophy or GA signifies a round or oval area of hypo or depigmentation at macula, having sharp demarcated margin and with minimum size of 175 micron on color fundus photograph. Another prerequisite for GA is visibility of choroidal vessels within its margins. The term GA has been in use for decades now. With the newer therapeutic approaches being studied for GA, there was felt need to quantify and characterize the macular atrophy in dry AMD. However, GA in itself is an endpoint of retinal tissue loss and it does not have any scope of defining precursors to the final tissue loss. The answer to this problem with the term, geographic atrophy, was to define macular atrophy in dry AMD with respect to OCT parameters. An OCT-based classification was the need of the hour. Hence, a consensus definition for atrophy associated with age-related macular degeneration on OCT group or CAM group was constituted. CAM has classified macular atrophy in AMD based on OCT features. Following were the two main principles of CAM group. Atrophy of retina was defined as loss of tissue or irreversible attenuation of tissue, and that the outer retinal layer loss can happen without the loss of RPE. However, loss of RPE is always associated with outer retinal layer loss. CAM classified macular atrophy in dry AMD into four varieties: cRORA or complete RPE and outer retinal atrophy, cRORA or incomplete RPE and outer retinal atrophy, cORA or complete outer retinal atrophy and iORA or incomplete outer retinal atrophy. cRORA is defined as following three OCT criteria: a loss of RPE extending at least 250 micron, along with an increased choroidal hypertransmission of same extent and overlying photoreceptor degeneration. The photoreceptor degeneration was further specified as loss of ellipsoid zone, interdigitation zone or external limiting membrane and thinning of outer nuclear layer. This OCT line scan shows cRORA temporal to the fovea. The area of cRORA shows complete absence of RPE band. The photoreceptor degeneration is denoted by disrupted or absent ELM and EZ. The area also has increased choroidal transmission, seen as brighter tail behind, over the choroidal layers. The two vital points which we need to keep in mind are that the loss of RPE in cRORA must not be related to an RPE rip. And cRORA by definition may have adjacent choroidal neovascularization also. The CAM group does not suggest to completely do away with the term geographic atrophy. Rather, it identifies GA in terms of cRORA. It suggests that both cRORA and GA have similar OCT parameters. However, the difference lies in the fact that cRORA does not take into account a presence or absence of choroidal neovascularization, whereas the term GA is strictly used when there is no choroidal neovascularization. So, there may be two subtypes of cRORA. One which is present along with choroidal neovascularization, and the other where choroidal neovascularization is absent. CAM group suggests to use the term GA for this later group. Hence, GA can be considered a subtype of cRORA. So friends, this is all about the cRORA. We hope that the video was helpful. The part 2 of this video explains other term, iRORA. Please do watch that one. Subscribe to Trick, the Retina Imaging channel. See you in next video.